how do we get cost controls into this system? It's one of the things that I think is concerning now is the way the healthcare insurance is set up with the insurance provided by employers, and even in the government programs, Medicare, Medicaid, the VA. You really don't have any incentive to shop for price because it's all going to be paid. And then if you look at your statement, I mean, the retail price is some astronomically high number, and then what's really being paid is a vastly lower number. And so the typical person looking around to have something treated is not looking for cost savings, they're looking for something else.
No, one way that this insurance was different from ordinary insurance was that ordinary insurance, it indemnifies you against loss.
Mm-hmm.
So if your car is wrecked, the insurance company writes you a check, and then you decide how best to, go out and buy a new car or put the money in the bank and walk to work or whatever. In medical insurance, it's a fee for service. And so the doctors have no incentive to cut their costs in order to gain market share. And a great incentive to add $1 or $2, as long as everybody else is charging the same thing. So this is an engine of costs going up. It's a really dumb idea.
So the reason we don't have a price mechanism in healthcare, which is one of the questions I asked at the beginning, is the way the insurance system was set up back in the 30s, and the way it evolved with the IRS making these companies allowing them to operate as nonprofit and getting out from under the state insurance regulators, where their cost of capital would have been a lot higher, and they would have had to compete more on price.
Yes, and that's the key to solving the cost of medicine is price competition. I mean, if the magic question is, doctor, how much is this going to cost? And under the current system, most of us just don't care. I mean, I had my gallbladder out 20 years ago, and I haven't the faintest idea what it cost because the insurance payer wrote the check. And now, of course, some medicine, if you're having a heart attack, you're not in a good position to bargain. But 85% of medicine is chronic care, not acute care. I mean, it's handling your bad back. It's handling, your overactive stomach or whatever.
Well, also, it doesn't cover routine things. It does, regular insurance, let's say auto insurance, doesn't pay for oil changes, doesn't pay for regular maintenance, whereas healthcare plans do.
Yes, and that is a very bad system because basically it's not insurance at all, which protects you against unexpected loss. It's a prepayment plan and a very expensive one because the government in its infinite wisdom decided that car insurance should cover oil changes. So it used to be you go down to the garage, pay the guy $25 4 times a year, and he'd change your oil for $100. Now suddenly he bills the insurance company, but he has to wait for his money and has more clerical expenses, so he charges $35. And then the insurance company has to, they have clerical expenses and they need to make a profit and what have you, so they charge you $50. So now in your prepayment plan, you're paying $200 a year for oil changes instead of $100. It's exactly the same thing in medicine.